All right, perfect. So welcome again, everyone, to our FIC National Coalition meeting. We have a few things to discuss with you today. We're going to start with a survey that was sent out yesterday, and that was on club stats after reopening. So if you could kindly all take a moment to fill out that survey. I'll actually just pop it into the chat box here to make it a little bit easier for you to do right away. It's not very long. It'll take 2 minutes. But if you could kindly fill that out, that would be great. And some other things to discuss. Ursa came out with some articles recently about wearing masks and other articles that I will send out in an email to everyone, so I won't waste time going through each and every one of them, but they are articles that are good for you to review as well. Other than that, moving forward, we're going to be changing up the structure of our Friday meetings. So as you know, we do.
Sorry, can I just interrupt real quick?
Yes, absolutely.
The survey that Trish is referring to is critically important for us to have our proactive media release, as well as for everybody on this call running facilities, so you can share with your members the fact that our safety protocols actually work. So please also share it with people not on this call, because the more data, the bigger numbers we have, the better. We talked last week at length about, how many hundreds of thousands, if not millions of check-ins have we had since we've been reopened, how many positive member cases or staff cases. But the real thing is the results of the contact tracing, is we're going to show that COVID does not spread in our facilities with our safety guidelines. And that's what we need to get out to get ahead of this so we can be proactive. So everybody on this call, if you can share it with your colleagues or, the folks that aren't here, the more data we have, the better. So thank you so much.
Yeah, and that way we have some data to send out to the public for press releases, and whenever we're asked about the spread, we have some answers that we can rely on. So please take a minute to do that. So the next few meetings, what we wanted to structure them as is kind of an alternate of provincial council meetings or provincial meetings, similar to what we do, where we begin with our updates and then go to each province, and then following doing meetings on best practices. So having presentations or somebody facilitating a discussion on best practices, that would be excellent. So if you are somebody who has something to discuss or would like to discuss best practices on, please connect with me so we can make sure that happens. That being said, Scott, am I missing anything before we move on to grassroots?
No.
Okay, perfect. So let's move on to Chris Gray and Peter Seaman, who has a presentation to share with us from Grassroots, who, as you know, are our lobbyists and are helping with our advocacy.
Hi, Tricia, it's Chris Gray here. Thanks again for the opportunity to be on the call and present. Tricia, I don't know if you wanted me to mention just off the top, just a couple of things that we were discussing this week with the advocacy that FIC is doing.
Yes, please.
Okay, so Tricia has drafted a couple of letters that we talked about last week to go out. One is to Minister Freeland, and that will be based on the rent subsidy issue primarily. And she also has drafted one to go to new Conservative leader Erin O'Toole, which is more based on the idea of an adult fitness tax credit. So those are the things that FIC is putting in the window in the near future with both of those folks. I also just wanted to mention that Tricia and I had a call yesterday with a staff person in the Minister of Small Businesses office. And while she wasn't really showing her hand, She was saying that both of, well, particularly the letter to Freeland and talking about the rent subsidy issue was a good idea, and keep on that. And so Tricia and I will continue to do that. On the rent relief, I was speaking with someone from the Retail Council this week, along with some other folks. And while they have not, well, the government has not yet extended the rent subsidy into the month of September, there's still a potential chance of that happening to the end of September. I know we're already in September, but there's still a chance that could happen. And there is also the, they're looking at potentially redesigning the whole program to align more greatly with what we are talking about, and to fill some of the gaps that are just not working in the program. So those are just a couple things that are in the hopper, and that Tricia and I are continuing to discuss with government officials. So more to come on that, I'm sure. And that's it from the general update on.
You're handing it over to me, Chris? Okay.
Yeah, unless there's any questions, we'll hand it over to Peter to run through the advocacy strategy on the provincial side.
Okay, thanks, Chris. We'll have some time afterwards for general questions, either related to what Chris has been working on the federal level, or anything that I've got in my presentation. So hello to all of you again. I think many of you were on some of the previous calls that I attended and participated. And there's been some ongoing discussions we've been having with Scott and Tricia, and I know that there's been communications back to many of you about the merits, the opportunities, the benefits, and the challenges around developing a more national advocacy strategy for FIC. So what I've done today is put together a few slides, tried to draw on some of our experience with other business associations across the country, and take a look at what we're facing with now, given the fact that there's a lot of significant things coming up in the next few months, both on the federal and provincial side, with delayed budgets and opportunities really to advocate. So how do we do that in the most effective manner? How could we, as our firm Grassroots, go above and beyond what we're doing already, which is providing some strategic advice and guidance on the national level, to actually supporting all of you across the country, or at least in those jurisdictions that wanted to participate. So I'll walk through a bit of a presentation. It's only a dozen slides, and then happy to take questions. So essentially, let's look at the current landscape here. I don't need to tell you that it's a challenging time, and advocacy and lobbying in normal times is a challenge, given how many competing voices are in the offices of government and making appeals for their issues. It's always busy. I always have to remind people when they go in for a meeting, and sometimes they can walk away with a real positive attitude, that those elected officials or staff members that they're meeting with are meeting with dozens of others on a normal week. And what's happened this year with COVID has only complicated things. We know that the economy is certainly shrunk. We know that people are concerned about that, and we're all concerned about the possibility of a second wave. Nonetheless, we've got businesses to run. The economy needs to keep moving. And now we're basically looking at how do we possibly package this advocacy campaign and deliver it in a manner that gets noticed by government. That's our goal. We can all, and you can all, go about doing things in an individual way, and I suspect many of you already have done that, whether it's to your local MLA or MPP. Maybe some of you have reached out already and have relationships with the provincial government, and that's great. What we've done, and hence the name of our company, is we believe that there's great strength at the grassroots level, and our expertise comes in building those campaigns, offering support and guidance along the way, so that collectively, as many voices as possible can be communicating the same things to government to get them eventually to act. Because the more people that bring those same issues to government, the more it resonates, and the more those issues sort of go up the priority polls. But it's not easy, because there's lots of competing voices going on. So we often talk about the 3C model of effective advocacy. It sounds simple, but it's often not done. And when messages, particularly from a broad audience, are not delivered clearly, it gets muddled. And if it gets muddled, government doesn't act. And I'll give you an example. There's lots of issues. I know that we did the survey we put out there, and we got a pretty strong consensus that across the country, the issues and those priorities that you view as important to government are fairly consistent around things like rent relief and the tax credit. But if we have a campaign that we want people to go and talk to their local government officials or in the provinces, and we want it to gain traction and get noticed, it's very important that we have agreement and consensus on what that primary messaging is, what the time span is in which we want to have those meetings. And that's what we work on with clients to ensure that we have that crystal clarity before we begin. Number two is making sure that all those messages are consistently delivered. That when we go into meetings and you have meetings with elected officials, whether it's in the same province or across the country, if the industry has agreed that, you know, these are the top 2 or 3 things we want to talk about, that we do that very specifically and consistently with the exact same language so that it sticks and it resonates. And if we've invested appropriate time on these 2, then we get the benefit of collaboration. You'll get more people coming on board. And above and beyond just the association of FIC and the individual members, it would be great if we could find a way, and we have some ideas on how to do that, to get even people who use your services, members of fitness facilities and others, to join in and also send messages to their MPs, MLAs, MPPs that this is an important sector for the benefit of Canadians' health and well-being that needs to be addressed and looked at and supported and not ignored. So this is kind of the model we work with. It takes a little bit of work up front, but we find when we make that investment with an organization like yours, we'll make sure that our chances of success are much better. And we have a team of people. These are the 4 of us, you know, Chris and myself. Catherine and Lindsay would also be supporting this, who have skill and expertise in communications and building these campaigns. But essentially the real strength of it lies with you. You, your fellow business members and colleagues in this business, people that use your services, because we have a fundamental belief that the most effective people to advocate and lobby for an industry are the people that live and breathe that industry every day. It's you. We're experts in building campaigns. You're the experts in your business. So we need to work together effectively. So essentially what we're going to do is talk a little bit about, okay, what's your role? What's our role? What might we try to accomplish in this? Because when politicians and incumbent people hear from constituents and businesses in their communities, whether it's their riding or their home province, it's far more effective than a hired consultant. We're practicing the traditional lobbying, which goes hand in hand with the grassroots level in terms of the things that Chris just talked about, and trying to leverage the relationships that we have at the highest levels to ensure that issues get pushed through. But the more voices we can have coming to government at all levels on an issue, the more effective it'll be. Now, the challenge is you all have busy lives. You have businesses to run, and I know it's a very challenging time. So many of you might be thinking, well, why do you want me to do this when you guys are hired to do it? And what we propose is a model that we would put forward to ensure that whatever time you were able to invest in this, it's very targeted. We provide you all the tools and specifics in terms of how to go about whatever amount of time that you invest, whether it's writing a letter or having a meeting, is done as efficiently as possible, because we've done this several times before with other organizations. So what would we have to do? Well, essentially on the clarity issue, one of the things that we would recommend is that there'd be a subcommittee of representatives in your organization that we would meet with on a regular basis to bounce ideas off of, to basically be our sounding board, if you will, on some of the messaging. And then that group would have to sell it to the broader group. We know it's always a challenge when you talk to 50 or 100 people, you get many different ideas. But fundamentally, we need some ideas that are going to represent in terms of the overall messaging so that government understands your issues. We may come up with a campaign, a brand, a name, and I'll show you some examples in a minute. Confirm that primary messaging. So what exactly are we going to say in our letters and in our meetings and in our one-on-one engagements? How are we going to ensure that the issue is very clearly communicated? And then just confirming those schedules. So it's now coming into the 2nd week of September. We've got a very tight opportunity in the next few months to try and lobby government across the board. Then we're hitting into December, and in the winter, there's another opportunity beyond that. But I would be looking at a very specific sort of 3-month window right out of the gate here to get us started. These are just some simple logos of different campaigns that we've worked on before as examples. So the one on the far left, Producing Prosperity, that was done for the agriculture sector across the country. That has a lot of issues, a lot of concerns, but they also have great benefits in terms of economic opportunity and food security if the government supports it. We wanted to create a positive narrative around why the government should support that industry, and we came up with that campaign. The Save Our Stores was a campaign that we built in Ontario for convenience stores that were facing a lot of different challenges, and ran that prior to the 2018 provincial election in Ontario to raise awareness around things that those stores were doing and some of the issues that were impacting them. The Fairness for Ontario Spirits is a campaign we're working on currently in Ontario that is looking to see that domestic distillers of spirit alcohol are given the same access to consumers as beer and wine as they are currently in other provinces in Ontario, in Canada. And from that one, we're focusing mostly on the economic benefits, not only to the government with increased tax revenue, but jobs and employment and things that go with that industry. And lastly, the one that Chris used to work with Heart and Stroke, and the Healthy Candidate campaign was a very effective campaign. They rolled out on multiple elections to encourage candidates running for office to sign on to be a healthy candidate. And when one candidate did it in a certain riding, they would celebrate that and challenge the other candidates for other political parties to do the same thing. It essentially was an opportunity to establish a relationship with people before they got elected into government, so that after they got elected, they could come back and visit them and they'd have a bit of a rapport with them. So that's kind of the idea of building a campaign. And I know that some of the issues that we talked about, as I mentioned earlier, are paramount. We also mentioned, and it was clearly communicated in your responses in the survey, that you're most afraid that if, and we don't even want to think about it, but if there is a second lockdown, that gyms aren't closed, that they are viewed as an essential service like so many others. So something around the idea of keeping Canadians healthy at a time when it's most needed. I don't know what those final words may be, but there's great benefit in coming up with a campaign, because it keeps all the messaging sort of under one umbrella, and it also allows people hearing it for the first time, like your elected government officials on both the provincial and federal side, to remember it, as opposed to, you know, I had a meeting with someone from the fitness industry and so did I, but they might have been talking about different things. So that's the idea of the grassroots campaigns and what we would work towards. Once we had the basics determined and agreed upon, we could move on this pretty quickly. Then we would start looking at all those materials we would need, the toolkits for you to maximize the opportunity you had with your elected officials in terms of communicating the right things, asking them for the right ask, and tracking all that accordingly. We would work with you to ensure that it's all tracked and we know how we're doing in different provinces or on the federal level as a whole. And one of the things to mention, I believe we talked about it before, is, you know, we can't work in silos here. If the asks are similar, there's a great opportunity and benefit for everyone if and when we can get one provincial government to move, if it's a provincial issue, for example, to move on something, to say, yes, we agree with that, because then the other provinces can point to that jurisdiction and say, look, this was done here. It's not like you're the first time and the first government that's thinking about doing something like this, and this is why it matters, and this is the benefit to government and to people as a whole on adopting that policy, whatever it may be. So after we've got the campaign built, we would then look at building all the materials to support it and ensure that the messaging on all levels is consistent and is heard. And number three, what we would do if working with you on this campaign idea is continue to look for other groups. I know that FIC is looking to expand its own membership, but I immediately think above and beyond and think, how could we get other organizations that are interested in the health and well-being of Canadians to say, yes, this is a great campaign and this ask is something that we support. We're doing that through endorsements that we can post online and send letters in to show government that this isn't just a narrow interest group. This has broad support here. But in order to get that, we need to clearly define what it is we're asking for. And if we don't do that, another group or another potential partner won't necessarily sign on. So clarity, consistency, collaboration is the 3C model that we use on building all effective campaigns. And moving on, what would we do? And I know there was some interest and concern about, okay, you guys are in Ontario principally, and we have relationships with other subcontractors we use across the country. How could you support me if I'm in BC, Alberta, or the Atlantic provinces? Well, I must say that while we can support you in terms of calling and making meetings, what we would rather propose, given that we're still in this COVID-19 reality and the traditional opportunity of organizing lobby days on the legislatures and at the legislature still for the most part are going to be suspended for some time forward, you're the best people to make the requests for meetings. But what we will do is provide you with the appropriate toolkits and training on how to go about that in the most effective way. Scheduling, we can track that. We're just bringing some software online that'll help us track those meetings and know for the people participating how we're doing, who we're meeting with, what the results of those meetings are. The materials we'll provide you so that when you go into a meeting, you have very clear and concise information you can talk about, you can leave with them. That's critical, and we do that all the time for clients. Social media and online, if there's budget to support that, and we'll talk about that in a minute, that's something else that we would drive for you or in collaboration with you to, again, promote the message and keep the message front and center for a period of time. These are some of the things that we would work on remotely. If there was interest or a need to have sort of boots on the ground for people to help who may have better or deeper relationships with the government, if you think that's of value in different provinces, we can partner with other groups, but that of course is going to cost of a bigger investment, because now we have to subcontract and bring other people in. And maybe some provinces have that and others may not. That all depends on how effective the fundraising is that I know that Scott's talked to you about. So moving on, basically, okay, what do you guys do and where does the money go? Essentially, all the stuff that we've talked about, we would be responsible for building and moving forward. So we'd have to help in collaboration with you build that message and build that advocacy strategy in terms of who is going after whom and why. We would support and work with the advocacy committee and obviously chair those meetings and run them to keep them going. We'd have oversight on all the communications and advocacy tactics, gather feedback, and do our best to try and get feedback from governments as well. But it's not complicated. It's just a lot to quarterback, particularly when we're talking about across the country and potentially lots of people to go through. So this is what we can do really remotely, and we've done it before for different organizations across the country. And in terms of variable campaign costs, well, these are things that we put in the original proposal to Scott. They're not needed. You know, we can build the framework of a campaign, provide the messaging, encourage you all go to have meetings, and then see how those responses are and follow up accordingly on its own. It's great to have an online presence and some social media. If there's budget, you can do things like advertising and promoting, media relations as well. If you have a place where people can go and read the story and understand it, that only adds value. So we put costs in here in the proposal for Scott to take a look at, and that's sort of dependent if the money's there. And then, as I said earlier, won't be a whole lot of travel right now. In normal times there would be, but if there's extra consulting required at provincial level, whether it's short term or longer term, we can certainly map that out depending on how successful fundraising is. And in terms of a schedule, well, we're ready to go right away. And I'm just mindful, given the fact that we know that the federal parliament's coming back in a couple of weeks. And here in Ontario, they're coming back on the 14th. I assume that most provincial legislature calendars are similar, and that the summer breaks are coming to a close. Governments are coming back. They're trying to determine what their priorities are, and if not, put out another economic statement, a budget, which is already overdue. Normally, those are all done in the spring, and COVID just upset everything. So there's a real important time here coming up in the next couple of months to try and get traction and get this message in, because there's going to be a lot of other groups doing the same thing. So we'd set up that advocacy committee, set a schedule of expectations, work on the creative and the primary messaging, as I alluded to a few moments ago. Build those toolkits. When I say toolkits, this is something that all be electronic. We could send to you. You could print it off there, or if there was a need, we could print them centrally and courier them out. But most of this can be done electronically and sent out. If we're going to build a website, that's got to be done. Are we tracking the engagements of people? Are we celebrating those supporters with pictures and social media and challenging those that we haven't heard from yet? Ongoing media relations. Happy to hear that you've got some good media already going. That's perfect. We can use that as content and information to communicate to politicians wherever appropriate. And then just overall offering our ongoing guidance and support in terms of, you know, the response from government may require a different tact, or how do we build a coalition of people in government? That's sort of what we would do. And there's a lot to do in the next immediate sort of 3-4 months. So immediate steps, if there's interest to move on this, the number one is just what's the budget that we're able to work with. I said 4 to 6 months. that's normally the tightest time frame we look to sort of putting something together like this. But if it's okay, look, we've got budget for 3 months or to Christmas, then we'll say, okay, this is what we can do on this. Confirm the members of that advocacy committee amongst yourselves and determine who's got the most interest time to contribute there. We don't need a huge number. It could be 5 or 6, but I would leave that up to Scott and Tricia and those of you that are interested to decide. Creative work on the branding and campaign theme. We would do that work, come back to you and decide what resonates the most, what messaging works, and ensure that your concerns are included in that and we're on the right path. Build all the supporting campaigns components. And lastly, do whatever research we can remotely on those MPs, MLAs, MPPs who have expressed interest, support for the industry. I suspect that you'll be able to provide us a lot of that already so that we can try and find a path above and beyond all the meetings to incumbent members in government, but maybe find some champions that could take this to the next level. So that's my presentation. I wanted to stop because I feel like I'm talking to myself on my computer, but I know you're hopefully all still there, and was curious to take any questions or just to see what other information that we could provide to get you guys to the point as to whether or not this was something you wanted to support. So Scott, maybe I'll turn it to you and I'll just be available.
Yeah, I think, thank you for that. We wanted to just make sure this group had a good understanding of kind of the tactics around lobbying. Part of our value proposition is lobbying. Part of the value proposition is doing roundtables to share best practices. We were talking about frequency of these meetings, kind of alternating with provincial, et cetera. So we will be presenting to this group, you know, our membership kind of structure moving forward. But we just wanted to have this opportunity to present kind of the mechanics behind the lobbying so we have a good understanding. So that was the reason for this presentation. We won't obviously do this every week, but we just wanted to make sure that everybody had that understanding of the mechanics behind it. So that's it.
Okay, Scott, I'll leave it with you guys, and we'll be available to answer any questions afterwards, but we'll probably sign off now.
Thank you.
Great, thank you. So that gives you all a little bit of an update on the process of the advocacy, and we will keep you all updated on any assistance we need, as well as any support you may provide us with moving forward. So with that, let's move on to some provincial updates. If we have anybody on the call from BC who would like to speak. I
guess it's going to be me. It's Angela. Hi.
Hi, Angela.
Not much new here in BC. We our numbers are going, unfortunately, up too. We had some modeling done yesterday, and I didn't see it. My husband did give me sort of the gist of it. And the best case scenario of come October seems to be that we are counting about 120 dead a day in all of Canada. And that was not the best case, it was about the medium. It was not the best. If we do something now, we were all masked or go back in lockdown. Or the worst case scenario was sort of the medium, what likely will happen. And I find that kind of a scary thought. I will take the advice. My daughter is stepping in for me to be more present here, and I will be starting as when the cold season starts to work a bit more from home, only come a day or two or every day a couple of hours, but I will definitely cut my time here down as I fall in the risk group. Other than that, we had 2 cases, and I didn't know. I talked with Carl what he said. We had a case where one of our members, a client, he tested negative himself, however, was told by the health authority to self-isolate because his son was tested positive. I may have taken a knee-jerk reaction saying anybody who ever has been told to self-isolate will have to bring us a doctor's note or an official note that they are that they can't come back into like into our gym. Maybe because there was another one who, she's a dentist, and I guess one of her patients tested positive, and she automatically was told to test. She now has tested negative, and she has the results. Clearly, I know that in 2 weeks it will be fine, but I would like to know what others say. I said as a general thing, as a general advice here and procedure, anybody who has been in self-isolation needs to prove that they are negative at that point when they come back. I don't know what else to do on that end. And then I did send this course thing to Tricia. I don't know. It's not an organization I'm familiar with, or it was I guess 3 doctors who founded an organization, and got a web designer involved. It's a certification. Don't know if it counts for adult education or not, but I found it give all the information condensed as we had on our back to work manual we presented to the governments. It's a bit more condensed. It talks about how COVID is spread. It talks about how many people are roughly not roughly asymptomatic, and things like that. So it's a 45-minute course, and I think it's similar what Dino did with in Manitoba, I believe, with the Tourism Manitoba to get a certificate. We did it, and I have to say I did two questions wrong. There was one question because it takes also into account people who go into people's houses. So how do you take your gloves, your mask, your gown, and what they essentially wanted to know, which was the order in which you do what. And I got that wrong. And one other I can't remember. But I decided to give all my trainers, because a lot of us deal with very young people, and they are not always as careful as they might should be. And so I have said, I will pay for the course, please do it. So they are going to be forced to read all of that, and then to take the test. They get a certificate. Once we have a certificate, we can show it in our doors. So it's twofold. I want my staff to be a bit more serious again about their bubbles, especially like on long weekends and beautiful weekends where they go. And the other one is the perception part. So Tricia has the information if anybody's interested. I did it. I don't know how much it does, how much value others might see in it. I think for us, it has value enough. And that's pretty much all from BC.
Thanks, Angela. So if anybody's interested in doing that test that Angela just mentioned that came out, let me know and I can connect you with that. So let's move to Alberta.
I'm sorry. Nothing incredibly exciting in Alberta except for the start of school. So schools started. From a member standpoint, from a facility standpoint, that has created a high level of anxiety. You know, what's the impact of that? So again, we're just trying to get ahead of the curve with collecting those statistics so we can show clubs, show our members that we don't transmit COVID in the facilities. And our safety guidelines are designed to assume everybody has COVID. So I think that's going to be critically important as we move into the fall. Sales still seem to be up, but so are pauses and cancellations. The other thing we are doing is once we get this data, we will be approaching the Ministry of Economic Development, the Minister of Health, to try and get relaxation on the 3-meter rule to 2 meters. There are jurisdictions in Canada that are at 2 meters, so we'll you know, make that case. So that's Alberta. Just of note, it seems like the super spreading events in Alberta are typically related to private parties in backyards and mass religious gatherings. So those seem to be the culprits, so to speak, for the super spreading events in Alberta. So that's it for Alberta.
Great, thank you for the quick provincial update there. Saskatchewan.
Hi, everyone. It's Sky. Excuse me. So, not sure if anybody heard, but Regina doesn't have many cases of COVID, but we had one we were informed on Sunday, this last Sunday, that there was a COVID case in Regina. And that person had previously been in one of our Evolution Fitness gyms the previous Monday, so 7 days prior to the confirmation of them having COVID. They had also been to a grocery store and to a restaurant. So Saskatchewan Health Authority called us on Sunday night and said, just be warned, we're about to do a press release saying that a person who was at your gym on Monday between the hours of 1 and 2 p.m. in the free weight section has tested positive for COVID. And so we don't actually know if this person had COVID when they were in the gym, because it was a week prior to them testing positive. Regardless, we said, what should we do, if anything? They said, don't do anything at all other than continue to do your disinfecting and cleaning, and just make sure if you have any employees that are sick, that obviously they don't come into work. I said, okay. So the news article came out, and this previous Monday, Tuesday, Wednesday were an absolute disaster when it came to cancellations and suspensions. It's tailed off now, but I've had probably 15 people come up to me and say, hey, are you okay? Is the business okay? A lot of fear around it, when we don't even really know if this person had COVID, and there's nothing really we could do about it. So today I called Saskatchewan Health Authority and said, guys, look, this hurt us. And the reason you guys did this, the reason you did a press release, is to inform anybody who was around this person to potentially get tested if they're feeling sick. They said, yes, that was our intention. I said, well, look, I have the ability to tell you exactly who was at my gym at that time. And I can give you their emails and phone numbers, and you can contact them, or I can contact them. Why would you want to do a press release? I said, well, typically we do it because, grocery stores and restaurants don't have that information. I said, great. In the future, if and when this happens to a gym, could you, instead of including the gym in the press release, just have the gym give you that information of who was in the gym at that time, or if they can promise to go ahead and make those calls? They said, that's a really good point, because this way it doesn't hurt your business, and we establish the intention of what we're trying to do, which is inform people who are around that person. So they are now considering it. So I'm not sure about your health associations, how they would, if they were going to inform you prior to doing a press release, if they are doing a press release. But my recommendation to you guys is, if you do get a phone call, try to lobby them hard to say, look, do not include me in that press release. You don't need to. And the reason you don't need to is because I have this information, and we can talk to the people who may have been affected and not the entire world, and create more fear. So that's my tip of the week for you guys.
Great, thanks, Sky. That was good advice there.
Yeah, very good. Good job, Sky.
And this is why we do these calls, so we can learn from each other. So that's very helpful. Thank you. Let's go to Manitoba.
Hey guys, so a little scary in the last couple of weeks here. We had our test positive rate up to 3%. I think it was actually over 3%, so we were a little concerned there for a little bit. Luckily, most people are doing what they need to do. They call it the fundamentals, so the mask, the social distancing, all that kind of stuff. We're back down to about 1%. Saying that, we've had quite a few deaths related to old folks' homes and that kind of stuff. But it seems like things are evening out a little bit. There is some community spread. I think he said about 20% of new cases are related to things they can't trace. So that means that at some point, we're probably going to have to deal with it in our facilities. I want to touch base on, I can't remember who said it, but basically what we're seeing from Manitoba Health is their messaging is that people do not need doctor's notes to return to work, to go back into stores and gyms and stuff like that. And the reason being is they don't want people flooding back into the medical system to get these notes. What they're saying is that people will be cleared by Manitoba Health to return to wherever they need to return. So we shouldn't actually be looking for doctor's notes. I don't know how that is in other provinces, but basically if people are told to self-isolate because they're positive, once they are cleared, by Manitoba Health, then they should be cleared to come back to our facilities as well. The other thing, if people test negative but still have symptoms, they still have to self-isolate until those symptoms go away. So for instance, last week or 2 weeks ago, I had a member who was concerned. He had some symptoms, he went and got tested, and then it came back negative, but he still isolated for another, I think, 10 days because he was sick for that long. So we are having to make some accommodations for these people that are staying away. And I think what we're learning as a society is that socially, we need to accept that people will be taking time away from the gym if they're sick, instead of encouraging them to keep coming back. Like, I think we normalized going to the gym with a cold. I think we normalized going to work sick and stuff like that. So I think that is going to change. And that's for everyone's benefit if people don't come to the gym sick. So that's what we're seeing here. The other thing I want to touch on is I want to thank all of you guys for actually following the guidelines, because in Manitoba here, we have 2 major companies. I don't think anyone on this call is related to those companies that aren't following the rules at all. So much so that they're getting thousands of new members, which is crazy. While businesses like ours that are following the rules are, steady, slow growth, kind of returning to normal. These businesses are exploding because people are flocking to them because there's no restrictions with daycare. There's no restrictions within bookings and stuff like that. So I want to thank all of you guys for taking that hit to protect your members. It's going to pay off. You're going to come out ahead because you are doing these things, because when things take a turn for the worse, your patrons and the community is going to know that you did the right thing. So I just want to thank everyone for doing what they need to do. It hurts now, but it's going to pay off in the end. And the last thing I want to touch on with Manitoba is we handed out our first fine to people that aren't self-isolating. I don't know if there's fines in other provinces, but somebody was fined this week for basically not staying home. So that's pretty much it for Manitoba. Just wanted to share that with you.
Wonderful. Thank you, Dina. Let's go to Ontario.
Okay, so some sort of good news, bad news in Ontario to start with. One was there was a case in a gym in Windsor this week that didn't play out very well. Unfortunately, it's the same gym that the article was written. They opened the outdoor gym when they weren't allowed to open an outdoor gym yet. So this is the second or third time they've come in, and they had a positive test, which was, that's not the big deal. But the same thing that the case that Sky just said, the paper published that somebody had tested positive and that they had been in their gym. So they said, and then when the paper interviewed the owner, the owner wrote an email to the paper, which was very, very defensive in nature, saying, this is really bad for our business. Why are you highlighting us? We're doing everything we can in our gym. And so it didn't reflect very great either in terms of how it was handled. The general manager said the same thing, kind of called out the paper for publishing the name of the gym that the person was in. And then unfortunately, I don't know if this has hit the press yet, but they've had a second positive test. So they got very defensive and in their reaction to it. And then now there's going to be another press release about them having a second positive test. So it's not a good case. They're not somebody who's been on our calls. They're somebody who I've sent the guidelines to, and I sent the rapid response plan to as well. But unfortunately, when in the paper asked them what they did, they said, we're following all the procedures, and we went through all of our security footage and looked at everybody this person had been in contact with in our gym, and then reached out to all of our members. Which again, instead of, if they had the check-in system, if they could just say, we knew everybody that was in the gym with this person and we were able to reach out to them directly, probably would have been a better message. But it just goes to, again, like the battle here on public perception of how this goes. And unfortunately, it wasn't necessarily handled very well. And there's, I understand the frustration from the ownership, just like Sky said, and dealing with public health. Especially since the positive stuff, there was an article that came out today from the person who's the person who runs the health side of things in Ottawa, who said that they've done all their contact tracing, and to date, there has been no spread in restaurants, gyms, or on public transit in Ottawa that they can tell. So that's the first time a positive article has come out to say there has been no spread. And so that was Ottawa specifically. I'll try to pass that article on. It's in one of my emails as well. So the sort of, like I said, some bad news, good news there on this front. The Ontario group had a really, really productive call this week. It was kind of spurred on. Oh, there you go. Perry's got it. Kind of spurred on with the idea of how we can build momentum on the Ontario coalition and get more gyms involved, because what we're still seeing here in this province is anytime the press goes out, they're getting some one-off gym to make an answer to it, or the default is to ask Good Life, which Jeff has spoken to as well. Like, they don't always want to be the speaking on behalf of the whole industry. But as importantly, as Sky kind of brought up too, or has pointed to a few other people, that having one person who's speaking to the government on behalf of the industry here in Ontario, so it's very clear. So our group is moving to make sure that we've got one point of contact, and it looks like it's going to be Chuck Kelly from Avati, who's had a lot of success dealing with all the way up to the Premier himself here in Ontario, and having him as the point of contact, and then making sure that we have a point of contact for any press, so that anytime any of these articles come out, they can get triaged out to 2 or 3 of us who are on the coalition, who can speak sort of more directly about what the industry is doing. The other thing, what was asked for from the group in Ontario was, and this is Tricia is working on this, and I'm working on this, trying to help too, is just a clear value proposition for why gyms should be part of, the Ontario coalition itself and the FIC in general, and how having a more centralized message is going to help both in the government side of things as we deal with the issues coming down in the fall and schools reopening and a potential second wave and all that stuff, but also with all this press and trying to switch the narrative a little bit there. And on that front, the idea of getting these numbers, I'm glad to see the survey come out. Thanks, Tricia, for putting that together. That was sort of our call 2 weeks ago. That came out of that to say, hey, let's get these numbers on how many members, locations members, check-ins, positive cases, secondary cases there are. So we have some data to counter whatever the case is, to show how safe it is. And just continuing to drive that narrative and putting a press release out. And we now have somebody who's going to, Chuck from Avati, his PR person, is going to work on behalf of the Ontario group to put stuff out. But just the narrative of, like, we recognize what the risks are in gyms, that there are, some risks in gyms. We're not blind to those. There's risks everywhere, and there are some risks in gyms. But here's everything that the people who are following the guidelines are doing to mitigate those risks. And as a result, here's what the numbers are showing in terms of how few cases are, that there isn't really cases spreading from staff and members who have been positive, and we're seeing that these safety measures are being very effective in gyms, and that's the story that needs to be told. So it's not running away from the risks that are in gyms, and it's also acknowledging that there are positive tests. But the key thing is that how effective these guidelines have been, and it seems like the only time there has been spread is when there's been a facility who is not following these guidelines. So that's the other part of it. Like, for example, the spin stew in Alberta. So that's the story that needs to be told. We're putting together a press release to put out in Ontario, and hopefully Chuck's PR person can help us get that message out in Ontario. And with Tricia's support, getting out this clear value proposition, all of the group in Ontario has agreed to basically pass it to as many other gym owners as possible, and operators, to try and get the group in Ontario to be as large and as inclusive as possible, so that we have as many people on our bi-weekly call as possible, especially being the biggest province. So Mario, who I don't think is on the call today, is going to also help sort of organize the membership for Ontario specifically. So Natalie, I think Mario might reach out to you for a few tips on how to help and manage and drive that. But it was really, really positive, because it's now coming from the whole group in Ontario that everybody is really pushing towards the same things. Let's make this group bigger and include as many people as possible, and make sure that everyone's communicating the same message, that PR is going through a designated channel, that the government is going through a designated channel, and being very organized here in Ontario. And everybody is on board to push that out. So we're just going to finish up these materials here, as again with Tricia's help, to follow up with, like, having that press release, having that value proposition to go out to gyms that has clear points of contact on it, so we can just get things really sort of keep this momentum moving in the right direction here in Ontario. So very positive week on our call. and hopefully we can prevent what happened in Windsor from happening too much more, or else like make them an outlier, or that they're outside of what the industry is doing collectively together, which is the story that needs to be told.
Great, thank you.
Nick, I'd like to add one more thing. Just everything Nick said is true, that we have some real great momentum here in Ontario, and it's very positive in our call. We have like Chuck from Movati, we have Jeff from Good Life, and we have Boutique on the same call, all ready to work together to share best practices that make the industry stronger. So I think that's extremely positive. Another thing to put into context is kind of, the PR is very, very important. With context, the auto article is excellent. And, kind of goes to what Sky was saying, what happened in Saskatchewan. We need to kind of minimize that and get the right message out through the PR. So hopefully we can get that done in Ontario through Chuck's PR contact. But put a little bit of context, Jeff from Good Life shared this little bit of information. They've had, Good Life Fitness had over 5 million workouts since they reopened across Canada. They've only had a handful of COVID cases. And out of those handful of COVID cases, not one contracted it in the fitness facility, and it had not spread to one other person in the fitness facility. So a little bit of context on if a club does a good job of following the proper protocol, that the gym is a good place to go work out to, relatively stay safe. And most of the cases are coming from social gatherings and younger people 20 to 40 years old.
Thanks, Perry, for sharing that. And that's exactly why we are doing this survey here, because we want to know what these results are. So I'm glad you brought that up. And then hopefully we can get more information like that from everyone. So just in case anybody missed the survey, I'm going to pop it into the chat box once again. So
Tricia, if I can add really quick, thank you, Perry, for that update. Also, with the cases at Good Life, they've also come from members traveling and not quarantining, it sounds like a martini, not doing the 14-day quarantine upon return, therefore lying about it on the survey they fill out when they come to the gym, and their memberships have been revoked.
All right, thank you, Mo. That's good to know, because then we know exactly where things are coming from and what the reasoning is behind that. Let's go to Quebec now.
Afternoon, everybody. We've had a week where, again, similar to focus, I guess, in Alberta, where the schools have reopened, and there's a big microscope around that to see what's going to happen as it relates to infections coming from there. The infections have gone up, and it's actually outside of Montreal now, seems to be a bit more related to Quebec City and a karaoke bar in particular. And that's where we seem to be having issues there. But the government is in we're about to crack down communication mode this week. And so they put out a press release yesterday saying they would move to a system that was like green, orange, red, and localize it in certain places, with the very real possibility, based on the number of cases per population, of shutdowns and localized shutdowns. And what seems to be the last to open will be the first to shut down. And unfortunately, gyms are a part of that. So we will reopen the lines of communication and see what it is. The reality is again, that's not where the cases, the majority of the cases are certainly the infections are coming from. It is actually from other places. And so we need to re-communicate that as strongly as possible, in the hopes that if there are shutdowns, it's not gyms again, because the second that something like that comes out, a bunch of gyms get cancellations and all that other kind of stuff. So we're going to reignite our conversations with the government to see if there's anything we can do about that, for gyms being removed from that category. On a bright note, having had conversations with a lot of club operators, I would say in the last week in particular, it seems like Quebec's doing percentage-wise actually really well in terms of members coming back. So the lowest I've heard in Quebec is, in the mid 50%, and the highest I heard is 80%. And some of the clubs are actually in September already, or end of August, September already, getting close to 2019 sales numbers. So the gyms themselves, the return of members and the beginning of sales seem to be doing well. And what I'm getting from a lot of people is that they are leaders, is they're looking to change the conversation, to not be like COVID's over kind of conversation, but to move it towards something that's optimistic and positive and taking care of yourself. And remember how this is the place where you're happy, not this is a place where everything feels different, because a lot of that has taken place already in the past weeks, but this is the place where you get to take care of yourself, have fun, feel happy, improve your health in all its aspects. And so a lot of the club operators are looking to change the conversation towards something that's positive with their teams, because we've gotten used to the sanitary protocols, and we've even gotten used to masks in a lot of cases. So we'll see. Those are the two bits of news that I have from Quebec.
Perfect, thank you. And then if we could go to PEI to finish it off.
Sure. Yeah, just like some of the other provinces there, schools are going back, so people are really hyper-focused on the kids going back to school and what that's going to entail. That's where the kind of governments in PEI, as well as some of the other maritime provinces. Very few cases here in PEI. We had a couple the last day or so, but all from out of province travel from essential workers. So really no instance of community spread. And yeah, like Dino asked, we have implemented some fines here for people that were not self-isolating. There's actually one guy that got tossed in jail for several weeks and is still in jail right now. There's some controversy around that, but that's what we've done here on PEI. Yeah. So club-wise, memberships are still coming back in slowly, but there's still a lot of clubs that have 25% of their memberships still on hold. Class sizes are still down because of social distancing. The government just lifted and allowed some more people in indoor spaces for public gatherings, but that doesn't look like it's going to affect us at all because of the social distancing rules that are still in place. So hopefully, as restrictions still lift, because I know there's a lot of club operators here on the island that class numbers are down because a lot of small boutique studios, so smaller space sizes, so class sizes are smaller to begin with, and now even smaller because of the indoor restrictions. But right now, the government's focus is really on the kind of back to school stuff. So I don't know if gyms kind of got put on hold, but we're hoping here in the future, once this all gets settled, then we can say what's happening in schools is done, and we kind of get back to the indoor fitness class stuff that everybody's really focused on. That's all for PEI.
Great, thanks, Rob. So I just want to wrap up by just kind of reiterating that we are doing a sheet on value proposition on becoming a member with FIC and why it's important to support us in all our initiatives and all the things that we are doing. So that will be coming out shortly, and that way we can encourage more club owners and operators to become members of FIC, which is extremely important when we are looking to support each other throughout the industry. And as mentioned, if you have any ideas for best practices or want to share a presentation or facilitate a conversation on best practices according to something that you have experienced in your club, please let me know and we can put that in the lineup. So please contact me and we can set up a time for us to share information that way. So that being said, if you're not a member of FIC, you know what to do. Go to the website, become a member, connect with me so we can make sure that you are a member. And that is it for today. Have a wonderful long weekend, and we will see you all again next Friday.
Have a good weekend. See you.
Thank you.
Thanks, everyone. All the best.
Nice job.